Today is the last day of Mental Health Awareness Week here in the UK. By the way, not to be confused with Mental Wellness Month, International Boost Self-Esteem Month, Time to Talk Day, Children's Mental Health Week, University Mental Health Day, Stress Awareness Month, Maternal Mental Health Awareness Week, World Suicide Prevention Day, National Depression and Mental Health Screening Month, Mental Illness Awareness Week, World Mental Health Day, and International Stress Awareness Week. I think there might be a problem here. We don't really need more awareness of mental health. All you need to confirm this is to look at the massive demand there is to see psychologists in the UK. For children, we have CAMHS, which is the Children and Adolescent Mental Health Service. In 2020, over half of CAMHS patients in Scotland had to wait longer than the 18-week target for a first appointment. And this is after the number of psychologists working in CAMHS had doubled over the previous decade. Children and adolescents with severe mental illnesses, such as severe depression, psychosis, and personality disorders, may also need to be admitted to hospital. But because of bed shortages, these under 18s can be sent to places over 100 kilometres away from where they live, isolating them from their friends and family. An investigation by the British Medical Association in 2018 found that across all ages, 3,700 patients waited more than 6 months for mental health treatment, and 1,500 patients waited over a year. And that's just from the services we bother to measure. Only 1 in 10 NHS clinical commissioning groups actually keep track of how long their patients are kept waiting. So the real number of people kept waiting excessively is likely to be much higher. It's almost as if lack of awareness isn't the problem here. The real problem is improving access to mental health treatment. But even if awareness was the main problem, it seems like we're being told to be aware of mental health most of the year. These dates stand out to me as a little too many awareness events. They basically mean that there's no point in the year that we all imagine as the mental health day or week or month, and individually these events have no meaning anymore. To give an analogy, consider waking up on Christmas Day, but it's after a year of 10 Christmas Awareness Weeks, 2 Christmas Awareness Months, University Christmas Awareness Day, Maternal Christmas Awareness Day, Children's Christmas Awareness Day, and so on. Maybe the meaning of Christmas would be diluted a little. Maybe wishing it could be Christmas every day is not the best idea. Are you aware of mental health? What does that even mean? Apparently, it doesn't mean actually learning anything about mental health itself. To illustrate my point, if you're watching this in 2021, Google Mental Health Awareness Week and go to the Mental Health UK website. Mental Health UK is the charity that created Mental Health Awareness Week, or this one at least. Come back and let me know what you've learned. For anyone cool who didn't just do that, the message of Mental Health Awareness Week 2021 is nature. Nature is good for your mental health. Now, this isn't a harmful message in any way, but I would have thought the point of a mental health awareness event is to encourage discussion and to decrease stigma around the subject. Correct me if I'm wrong, but what is the stigma that exists against nature? Is there anyone out there who thinks nature is bad for your mental health? Let me know in the comments if that applies to you. What do you actually learn about mental health by visiting the Mental Health UK page on Mental Health Awareness Week? Anything about particular conditions? Any stigmas we need to discuss and tackle about mental health? No, but you can print your own tulip, colour it in, and place it in your window, so it's all good, guys. According to the Black Dog Institute, which is a mental health not-for-profit in Australia, we have at best some evidence that mental health awareness programs increase knowledge about mental health. But there's actually no convincing evidence that these programs change behaviours that actually matter, like help seeking for mental health problems, suicidal behaviour, or reaching out to help other people. You can see similar issues if you look to other awareness campaigns, like those about substance abuse, road awareness, or preparing for a natural disaster. So what can actually help our mental health in a meaningful way? Mental health issues have many causes that are outside our control. We might have a family history of mental illness, so we inherit them from our parents. We might have experienced childhood trauma or suffered a head injury. But there are also plenty of factors within our control, and as a society, we have the power to change. Things like loneliness, discrimination and stigma, unemployment, social inequality, lack of access to mental health treatment. These things are much more significant than whether we spend time in nature. You can go and walk around a field as much as you like, but if you've just lost your job and you don't know how you're going to make ends meet, your mental health is still likely to suffer. So why doesn't mental health awareness choose any of these factors as the theme for the week? I think it's because it strays into politics, and we can't politicize mental health, right? I say, f that. Mental health doesn't occur in a bubble, and politics doesn't occur in a bubble either. Our lives are literally affected by the decisions people in power make every single day. I'd argue that Marcus Rashford's campaign to get free school meal vouchers provided in the holidays did more for mental health than this Mental Health Awareness Week ever could. So in conclusion, has Mental Health Awareness Week done any harm by encouraging us to connect with nature? Probably not, but equally, has it done any good? Also probably not. Maybe mental health awareness campaigns could cause meaningful change if they, one, happen less often, because there are so many awareness events that they all feel kind of meaningless, and two, discussed more relevant issues, even if they're political. People might improve in mental health if they can actually get the treatment they need, or they don't have to worry about having enough money to survive. So those are my thoughts on Mental Health Awareness Week. If you like the video, check out my video I did last week on unconscious bias training. If you're new here, I upload videos about psychology and self-improvement every week. So subscribe for more, and I'll see you next week with another one.